From the top, make it drop. That's some wet ass pussy. Now get a bucket and a mop. That's some wet ass pussy. I'm talking wop, wop, wop. That's some wet ass pussy. Macaroni.
Your health should be first up. That matters most.
I like that you said that, touching on the point of long-term relationships. I don't know if you remember, but I will never forget, we had sex ed like in seventh or eighth grade, and it was a lady who taught that class. And someone asked her about condom use, and I'll never forget her response. She said so effortlessly, people don't know what their partner is doing. They know what they tell you.
Correct.
I was like, 13-year-old me never forgot that. And the idea of I'm in a long-term relationship or we love each other and girl, you don't know what that person is doing when they're away from you.
Honestly,
So just removing emotion and mental out of your relationship always kind of go with your brain when it comes to sexual health and behavior because you just never know. And I was just like, wow, I'm glad she said that.
Yeah, you don't know. And it's literally like going into a detective's office and they're trying to find suspects and you see that red tape just going around and around and around. And even so, let's say that both parties are being completely honest. And right now you're both monogamous, right? But what did their past look like? Right? Was it only one sexual partner? Okay, and if it's one, that's fine. But were they having protective sex or were they not? Had they contracted an STI previously? Had they not? Like, I think that sometimes people get a little uncomfortable asking the questions that should really be extremely comfortable. Like this, again, this is your health, and one hot, steamy moment can change things forever. Like, yeah, we're talking about BV, but what if it's one that is incurable, or what is one that literally just keeps coming back? Like BV can be annoying, although like BV borderline, some say it's an STI, some say it's not an STI. You know, the research is really not there to support it. But anything that constantly comes up and is altering the comfort of your life makes for a sticky situation. So we have to demystify these taboo conversations and get comfortable asking, I guess, the hard questions, when to me, it really shouldn't be hard to talk about your health.
100%. Like, this is the purpose of this space right now. Like, breaking down stigma, creating comfortable conversations, because there's a split here, right? Like, there's a juxtaposition of having a behavior, but I can't talk about it. Make it make sense. I can't talk about sex, but I can have as much free sex as I want to, and the conversations are uncomfortable, but you're not comfortable participating in the act. Like, we have to make the knowledge and the behavior line up and be in alignment with one another for overall health and safety. And speaking of STIs, because that's our next pivot in the conversation, that's another debate I faced in my research too, because some data would say, oh, BV is an STI. But it's like women who have cleared BV not have sexual partners for extended amount of time, and then the BV comes back. So they're not having sexual factors that can throw them into a BV type state again. So what myths do you think are out there? Because, you know, you hear people say like, oh, just eat a protein heavy diet and have lactobacillus, eat your yogurt, eat your fruits. Like, do you feel like some of that is myth, or is it fact, or what's protective day-to-day things that people can do to prevent BV?
I'm actually not sure. I know that some will say like a probiotic could help. And that's really the only thing that I have heard. But again, is the data fully supporting it? Not really. Like maybe kind of, sort of, right? So I'm just like, I'm not really sure.
That's a good point, because actually I was just teaching my students this week about like research and the different biases that come across. And because, again, the number is so low with African American female participants in research specifically, I wish the numbers were there to support, like, yes, this shows a strong association of lactobacillus in your diet and probiotic. This completely can change your gut health to your vaginal health. And I think it's the theory is there, and I think it's a positive possibility, but it's no harm in doing it. So let me put it
Right.
that way, obviously. But I don't know. Again, low numbers in research seems to be our biggest hurdle right
Yeah,
now.
it's the biggest obstacle. It's a huge barrier for sure.
And it's so weird. Because in 2026, why are we still having all these
Um,
question marks
it's a
around?
matter of what's important to the people, to the powers that be, right?
Right. Ugh.
Because I saw a post on Instagram, maybe it might have been yesterday,
Hmm.
and it was in regards to the changes that the vagina and the vulva go through during menopause.
Okay.
And if this were something that occurred in males, oh, the
Mm.
research, the money, everything would be there. But since
Mm.
the people who control everything are male, we live in a male dominant society. And if they're not directly impacted, it's a non-factor. This is not important. Just like they don't necessarily bear children, but they can tell you whether abortion is illegal or not. But
Right.
now, if they actually had to go through these things, and if they were actually the ones being raped and had to be forced to carry that trauma for X amount of time, and then been told, like, maybe you got to keep it, or maybe you can't give it, all these
Hmm.
different things, we would be looking at things very differently and having a very different conversation.
Of course. Of
So
course.
it's the harsh reality of they don't care. And so,
Hmm.
in order for us to get the answers that we desire, is going to take probably some self-funding, research and focus groups to get the data.
Ooh. And this ghetto government, friend.
You know, it's
Because
real rough
they
out
cut
here.
a lot of the STI funding, the research, the
Oh, they
resources.
cut like everything.
It is gone.
Yeah,
Like, not me finally graduating, doing what I love, and then the workforce is like, yeah, we're not gonna really.
yeah, correct. It's unsettling to say
Okay.
the least. Very infuriating.
Yeah.
Yet we move.
It's
Yeah,
got to be a way around that.
yeah.
And specifically with BV, I do want to speak on the relationship between BV and STIs. So they have a proportional relationship, right?
Mhm.
Where if you have a BV diagnosis, you're more susceptible to contracting an STI. Or if you have an STI, that disrupts your vaginal makeup. So now you are more than likely going to
Catch
be
22 in me. Yeah.
positive for BV as well. So now we have both working in the system, and that is upsetting for a lot of women because it's like, okay, and let's say the STIs are curable, like your bacterial ones, chlamydia, gonorrhea. Let's say they don't have some sort of antibiotic resistance.
Yeah.
So you'll clear one, but then you have a lingering BV. Or if you clear your BV, then you might have another reoccurring STI, which I've heard women get from the same partner. So how would you help them navigate that? Because I can see like, okay, I had an STI, my partner had an STI, we both got clear for it. I took my medicine, I'm fine. But if it keeps
Mhm.
coming back, and you say, of course, use of condoms, but it's like, okay, what if I want to have a baby or if I'm married? Like, how does someone navigate that?
To my understanding, an STI that's recurring means like you are constantly being reinfected. So is your partner really only having sex with you?
Oh, well, okay.
Because
So from the research I was doing, for example, trichomonas and mycoplasma, it's like the bacteria of that is so it's stubborn. It behaves. I would say like it has this resistance, but like the guy can clear it, and the girl, like the test, I don't know, like the sensitivity or specificity of the test was causing, okay, I test positive, I take the medication, I should be cleared, right? Because sometimes in those spaces, you don't come back to see if you cleared the medication. The doctors will give you the medication, do the 2 weeks, you should be good. But who's actually checking to make sure if I cleared it or did I get reinfected again? So we have this confusion amongst women
Yeah.
where it's like, what really just happened to me? So
Yeah, I would definitely recommend going back to get tested again. Because I
okay.
think can't quite remember if it's chlamydia or not, but I know one of them you're supposed to go back, I believe, within 4 months to
Oh.
get checked again to see if, and I can fact check
Mhm.
that afterwards. So go back to see if you have completely cleared the
Okay.
infection or
Hmm.
if, do we need to give you another antibiotic, right?
Okay.
And I think that maybe that part actually isn't talked about enough because I will say that is
Yeah.
something I learned while studying, not necessarily something that I saw in the clinic or the hospital.
Mm.
So no one verbally told it to me. It was just, studying for an exam.
Yeah,
Then you learned it.
because and the reason that I asked that, I do not want this
Oh, your
computer to
computer
die.
dying.
But the reason why I asked, okay, we're back. The reason why I asked was because from my research that I was doing, a lot of the times that's not part of the recommendation to do the follow-up. So women, they'll test for something positive, take the antibiotics, you should be good after 2 weeks. Let's say they do that, or let's say like you said they don't I feel fine, you don't finish the required medication dose and you go on about your life. Okay, where are you for real? What
Yeah,
is your status at this
yeah.
point? So it's too many question marks for my comfort. I'm surprised that that's not reinforced, but I think that has a lot to do with resources, access, insurance.
Yeah, and I mean, it sounds like the guidelines need to be updated too, though.
Yeah,
And technically,
100%.
when people have guidelines, then the providers also need to adhere to the guidelines. Right? Because a lot of people, I will say,
Hmm.
especially if you're more experienced in practicing and you're not at a teaching hospital, it's
Hmm.
easy to not be as up to date on things. And,
Hmm.
you just moving off of routine. I've been doing this for so long, but it's
Yeah.
very, very important, especially in medicine and in education, to stay on top of what is the new research, what is the new data, what are the new guidelines saying. And that's
Yeah.
how we can start to shift our focus with practicing medicine. Because that's the thing, it's a practice, right? And when you practice, you got to continue to get better at it, which means you have to always study.
As far as STIs go, if you could just break it down, like we have bacterial STIs, viral STIs, parasitic infections. A lot of times you'll hear people, grown people, not even know the difference between these different STIs and the impact that they can leave. So just a real quick briefing from the Dr. Vics herself
Girl,
on STI education and what how women can go about moving forward if they were to get an STI or prevention.
I mean, honestly, as they're gonna tell you in church, the best sex is no sex. If you don't have sex, you won't get an STI. But that's also
On
very
Bible.
unrealistic. I'm like, that's also very unrealistic, right? Because even in the
Right.
Bible, people were
Hmm.
jumping around. But like I previously said, it's very important to use protection while
Hmm.
having intercourse, having sex with people, and knowing your status. Because yeah, you only know what people tell you, and then like you said earlier, people be lying. But if you know what you have, then I mean, at least you're not lying to yourself,
Right.
right? And to get tested, that could be a blood test. And I believe blood should be HIV and is it syphilis by blood? And I want to say gonorrhea and chlamydia are by urine. And to be honest, those are the main ones that they're going to test you for when you go to the doctor. So
Hmm.
if you say you want to be tested for HSV, which is herpes simplex virus, 9 times out of 10, they're not going to do it. They can, but they're not because mainly everyone has herpes. And because when
Hmm.
people hear herpes, they just think, a cold sore. Well, they actually think genital herpes, but that could be a
Right.
cold sore. Varicella, chickenpox is part of the herpes family. And then I believe like Kaposi sarcoma, which has some type of tie into HIV. There are so many different variants of herpes, of which I did like a research project on my freshman year of college to
Hmm.
become more knowledgeable myself. So since
Hmm.
it's very common, that's not one that they're going to test because then I guess it goes into more like what's the strain of herpes that you have. And that one is more of a
Hmm.
like be on the lookout if you've ever had lesions, if you ever had open
Right.
sores on your genitals or on around your mouth. But what else was it? Oh, and knowing the difference between if it's a viral infection, there is not an antibiotic that you can get. Antibiotics are for bacteria, right?
Yes.
And that's something that's very, very important, even beyond STIs. You get a common cold, that is a virus. And you just kind of got to let it run its course. But just the very, very basics of it, chlamydia and gonorrhea are the most common STI. And I believe from when I was studying, it might be like 34 and younger, but mainly like 25 in the teenage years up to 25 specifically, it's rampant. And yes, you can get medication. You could get doxycycline for chlamydia and ceftriaxone for gonorrhea. If you have one, they're going to treat you for both because they kind of run together like besties. Not the type of best friends that I would like to have, though. And your partner would also need to be treated if you ever get that. So safe sex is knowing your status. Like that is the safest sex. I would never tell someone not to have sex, especially as a healthcare provider, because then you're going to feel like you can't trust me. I want you to not just be honest with me, but be honest with yourself. Know your status. And if you ever contract an infection, which we have now changed the language from sexually transmitted disease to infection to try to reduce the stigma around it, always tell your partner. Update your partner, your partners, whomever you've had sex with, so that everyone can make the actual like choice on how they want to proceed.
Did you have anything that you wanted to add that I might not have asked, or anything in particular?
I mean, not really. Mainly my thing around reproductive justice and sexual health is agency. You have agency over your body. You have full autonomy over your body. Do not let anyone tell you otherwise. I don't care if that's your best friend, it's your partner, it's your parents, it's your healthcare provider. You come first. Always know and believe that. And anyone who doesn't believe that you come first, well, I have bad news for you. You need to kind of kick them to the curb and move on.
Just keeping it 100.
Yeah, like keeping it real. Like if your healthcare provider is telling you something that's completely adversary to what you believe in and what you stand on and what you know, it sucks to suck for them because you're going to be someone else's patient. And that's with the partner. Like, don't let anyone control you. Like, know your status. And I mean, honestly, get tested. Like, like you were saying earlier, some things can lie dormant. So if you would think that, well, I have been abstinent or celibate for this amount of time, it never hurt nobody to routinely get tested. So know your status. It's cheap. It should be covered by all insurances. And if you don't have insurance, Planned Parenthood is a great place to go to get things done for the love. Okay. So yeah.
That part. Well, thank you, Dr. Vics. And until next time, protect your cat.
Bye, y'all.
Bye, girl.
From the top, make it drop. That's some wet ass pussy. Now get a bucket and a mop. That's some wet ass pussy. I'm talking wop, wop, wop. That's some wet ass pussy. Macaroni.